Hi, I'm Judy Marie, and today is another episode of Health Beat. Today we're going to be talking about health and the things that can impact on health. As well, we'll be learning a little bit more about a special event that happens in Kenora every year. Today my first guest is Dr. Kit Young-Hoon, our Medical Officer of Health for the Northwestern Health Unit. Hi, Kit.
Hi.
Welcome to Health Beat.
Thank you. It's great being here.
Oh, I'm glad you could join us.
Yeah.
When we talk about health, there are so many factors that impact on our health. Can you tell us a little bit about that?
That's right. There are many things that impact on health. And I think usually when people think about what impacts on your health, they often think about, how physically fit I am, or how much exercise I get, if I eat enough healthy foods, if I smoke, or what, if I drink too much alcohol, or what runs in my family. So these are some of the things that people think about that do impact on their health. But there is an increasing understanding that there are actually much broader, bigger factors that impact on health. It is estimated that 50% of health is determined by social and economic factors.
So things that may not be in people's control.
That's right.
Because a lot of times we talk about, like you said, eating and sleeping and physical activity, and that puts a lot of pressure on the individual to help maintain their health. Can you give us an example, Kit, of some of the broader aspects that impact on our health?
So those broad factors include things such as income, education, employment, other factors such as access to healthy food, housing, early childhood experiences. And then factors such as gender identity, racism, discrimination, disability, and language. If we were to look at income more closely, what we see in that particular social determinant of health is that as income increases, your health improves. So people who live in low income or who live in poverty are at increased risk of having lower life expectancy and higher mortality rates. And that applies to a wide variety of illnesses, including cardiovascular disease, heart disease, lung disease, and a variety of cancers.
And things like education, sometimes maybe even where people live and having available, access to the healthy food and things like that can be an impact as well. One of the words that we hear a lot about, especially in the area of public health, are the social determinants of health. So is that the same thing as what you just mentioned?
Yes, the social determinants of health are the social factors that impact on health.
Okay.
And a variety of national and international organizations are increasingly recognizing the impacts of the social determinants of health, including the World Health Organization and the Public Health Agency of Canada.
When we think about health and we think about the social determinants of health, there's a lot of information out there about what we can do as individuals. The new Canada food guides coming up, and that there's guidelines for alcohol use and for physical activity. But what are some of the things that can be done to help address the social determinants of health?
Mm-hmm. So working towards improving social factors that influence health, like income, education, and employment, would be huge, right? So that requires a whole of government approach. So that means every level of government has a role to play, and within government, each ministry has a role to play in thinking about this issue and how to support people who are most vulnerable, particularly with these social factors. When it comes to income, some of the things that could address low income and poverty would be ensuring that there's an adequate minimum wage, ensuring that there's adequate social assistance rates, and also the basic income. For other social factors like housing first principles are very important to improve on health. And then when we think about factors such as early childhood development or early childhood experiences, ensuring that there's supportive programming for high-risk families and improved child and youth programming can improve those early childhood experiences and therefore improve on health.
Is there anything that we as individuals can do to help address the social determinants of health?
Well, as individuals, I think there are definitely the opportunity to get involved in charitable organizations and to support those. But I think to bring about real change and to bring about that larger policy change involves individuals taking the time to learn about the social determinants of health and how to, some of the big policy areas such as minimum wage and the basic income guarantee. And then, and once you've learned about it, to really be discussing that issue with your MP and your MPPs, so that they're aware, but that this issue is important to you.
So say, for example, you belong to a retirement group, you know, maybe you were a former teacher or healthcare worker, would be starting to have these conversations in your local groups be a good idea to start get people thinking about the social determinants of health?
Definitely. So that's a good way about creating that conversation among everyone, so that people are aware of what's happening, that they're aware that there is something that can be done. It does require a certain amount of public push so that the government knows what the public wants, and that can be made more, that can be emphasized, you know, by writing letters to your MPs or your MPPs, or connecting with them to tell them about the importance of social determinants of health and about what can be done.
And in some ways, too, that kind of takes the pressure off the individual, because we certainly don't want to blame the individual for their state of their health or that. I mean, people can do what they can do to try and be healthy, but realizing that there are so many broader factors that impact on it that people maybe in their daily lives don't have the direct control over. And I think that takes a lot of the pressure off, because the key message of the show is to try and get the word out to help people learn about more things that they can do to be healthy. And I think, Kit, that certainly brings this into that world and expands that worldview on the area of health. Mm-hmm. Was there anything else, Kit, that you wanted to say about the social determinants of health, or that you thought might be important for our viewers to hear?
I think you brought up a really good point there, and that is that with these social factors, it is about thinking about the system and how the system impacts people. And that because of how the system currently is, if someone is experiencing disadvantage with these social factors, they often don't have the control, and therefore it makes it harder for them to take control over their own health and to take positive actions and to do basic things such as eating healthy foods. For an example, if you have low income or you're living in poverty, it's difficult to ensure that you have access to healthy food, that you have access to adequate housing with a kitchen that allows you to cook healthy food and therefore be healthy. So some of these things need to be addressed in order to improve the health of the population.
And that certainly fits with the philosophy of public health, which is looking at a broader population health strategy as well. So that social determinants of health are very important in the work then in public health.
That's right. That's right. So these broader factors, by influencing them, we're also talking about preventing disease. Mm-hmm. So it becomes very difficult to considering all the resources and human resources and the budget that's required to treat and to help people who have a variety of different illnesses. If we were to use that same funding and apply it to social factors and the improvement of things such as income, employment, education, early childhood experiences, that will prevent the further burden on the healthcare system. It also reduces the burden on other systems such as social services and enforcement.
Kit, we're going to take a short break. We'll be right back after this short break. Welcome back to Health Beat. For this part of the show, we're going to talk about a special event that occurs every February in Kenora. And with me is my guest, Nan Normand, executive member of the committee called Making Kenora Home. Nan, hi.
Good morning.
Thanks for joining us on Health Beat today.
Thank you very much for inviting me.
Nan, can you tell us a little bit about Making Kenora Home and what's involved in it?
Making Kenora Home is a broad-based, grassroots advocacy group that developed in response to the community's concern about the lack of affordable, accessible, and appropriate housing. Many people in the community shared the concern and weren't sure what direction to come in. There is a shared belief that housing is absolutely core to poverty reduction and social development. And the lack of housing was stalling everything. As our previous guest talked about with the social determinants of health, we know that how crucial housing is.
Mm-hmm. And you hear about that in a lot of circles and a lot of people that I run into in Kenora, whether they're seniors or they're concerned about, you know, people living on the streets. So there's a whole continuum of the need for housing in our community. What is some of the work that Making Kenora has done in the past?
We have done many things. What we've done that is most helpful is because we, as an organization, one of the things we saw when we first got together was that there are a lot of groups who share our concerns, but there's always this struggle for funding that's divisive. Making Kenora Home as an organization refused to expand into developing programs or having paid staffing. That way we've been able to stay objective in our research, in our advocacy efforts. We've been able to support other groups without having to worry about whether our mandates have overlapped in some way. And we've been able to be a voice that doesn't have political connections in any way.
So you mentioned advocacy, you mentioned some research as some of the activities that have been undertaken by Making Kenora Home. And coming up in February, there's a very special week that's happening, and my understanding is that this is the only week across Canada where this
Around the
happens.
world.
Around the world, wow.
Yeah.
So can you tell us about that, what it's called, and some of the activities?
Week of Action Against Poverty is an opportunity for everyone in the community to show how Kenora cares by setting aside 1 week where we focus and publicize what's the heart of Kenora. Then we show everybody. We set an example for our youth. We show the rest of the world, and we show our commitment. There's so much negativity about what's wrong. There's an awful lot that's right in Kenora. And this is 1 week that allows us to shine.
And how many years has this been going on?
This is our 12th week of action.
Wow.
And over time, the list of projects that have gone on, there's been everything from theatrical productions to research releases to entertainment events, concerts, fundraisers, challenges, and every year there's something new.
I know I participate in a couple. There's the annual book launch, and as well, I remember being in front of City Hall and there were mittens strung across, and then the mittens were donated. So kind of a fun event, and you know, helped people in the community and also raised awareness. Is there anything special planned for this year?
Week of Action, because it's all individually motivated, is a surprise package. We're never quite sure what we're going to see until it actually happens. I can tell you that on February 15th, the Mount Evergreen and Nordic Ski Club will be hosting an event. I'm not sure of the details yet. On the 16th, the Ladies in Black will be holding a giant recycle and reuse, rehousing our treasures sale at the Ride Out Community Club. And a portion of all the proceeds will be donated to local charity. Our regular events will be happening. The ones you mentioned, the
book launch?
A book launch. We'll be focusing on how sometimes we're just one slip away from homelessness. So it will be interesting to hear how close we are to it. There will also be a workplace challenge this year with an award for the community champion. Details on that will be going out soon.
All right, that sounds
Let's
fun.
get competitive.
Yeah, yeah.
And it is about fun. I mean, so many things have happened that have been, there's nothing wrong with having fun when you're doing good. You mentioned yours. You liked the mittens and the book launches. My all-time favorite was the song that was done across Kenora. There were 22 singing groups, all singing at the same moment, and it was launched from City Hall, everyone standing up to proclaim the need to build.
Wasn't the song "If I Had a Hammer"?
Yes, it
because we
was.
did that at the
Yes,
health
you
unit, and it
participated
was
there.
fun. Yeah,
I
yeah.
was at City Hall. I know which counselors are the best singers now.
Ah, great.
Yes, they hauled in their top singers. We all have our favorites, and then it changes because the next year something else comes up that we never thought of.
So there's the poverty challenge.
Yes, this year that will be undertaken by educators. Last year we had members of the health sector taking part. This year there'll be members of our education system. And I'm looking forward to that because our teachers and our class aides, they know how to teach well. So their blogs will be very interesting.
And I have followed some of the blogs in previous years. It's quite an eye-opener.
And after all these years, there's always something new. There's always a new learning.
That's very interesting. Nan, now if people wanted to get involved in the Week of Action Against Poverty, or if people wanted to find out more about what's going on in the community, how would they do that?
Well, it's very easy. If you want to develop an event yourself, go for it. There aren't any rules. The only guideline is that whatever you're doing benefits a local activity. And if you want to join a group, look around. You can check on our website for ideas from past and postings from what will be happening. If you just want to call and chat and develop an idea, you can give me a call. My work number is 468-8888, and I'll be happy to talk to you.
Wonderful. So we'll look forward to the many exciting events that come up this year, and hopefully we'll have some new surprises to add to the list.
I look forward to the surprises.
Wonderful. Nan, we're going to take a short break. Thanks again for joining us for this segment of Health Beat. We'll be right back. Welcome back to Health Beat. My guests today are Dr. Kit Young-Hoon, Medical Officer of Health at the Northwestern Health Unit, and Nan Normand, Executive Member of Making Kenora Home. Hi again.
Good day again.
Hello.
We've covered a lot of material about health and the impact on health. We talked about the social determinants of health. What do you see as one of the largest issues facing Kenora that has an impact on people's health?
To me, it's the lack of housing. I mean, that is absolutely core. And without housing, we can't go anywhere. I'm also concerned about the lack of programs to support housing, to make it successful. And because I like threes, my third, it's the marginalization of people within our community. If they, because of our history, general impoverishment, and policies and our history of historic racism, we have a very splintered community and social marginalization. Unless people begin to feel good about themselves and where they're going, we're not going to make any progress. And to me, it begins with housing.
And we've lost a lot of affordable housing over the past couple of years due to fires and other circumstances as well. And this fits in, Kit, with what you were saying earlier about the social determinants of health and the impact.
That's right. Yeah, and I agree. I think housing is a big issue for Kenora, for many people, but it particularly affects those who are most vulnerable, who have less choice and less avenues to meet that need. I think other ones would be income. So income as a social determinant of health is so pervasive, and it affects many other aspects of social factors. So income affects housing. It also affects access to healthy food. It also prevents education or good educational opportunities. And it also impacts early childhood development. 1 in 5 adults and 1 in 3 children live in households that are low income or in poverty, which are huge statistics and much different from the province.
Northwestern Ontario has one of the highest rates of family poverty
That's right.
in the province.
That's right.
Wow, those numbers are huge.
And it's real for Kenora. This is our reality.
Yeah.
Yeah.
When we talk about housing, I've heard the words housing first strategy. Would you like to share a little bit more about what does that mean?
Many people are talking about it because it's been demonstrated that it is the most effective strategy, but not all that many people understand the reality of housing first. Housing first prioritizes getting people housed immediately in places that they want to live, and then dealing with everything else after. It's not a transitional program. It's taking people where they are and supporting them in the way that they see themselves needing to be supported. Mm-hmm. I worked transitional housing programs years ago, and they're not successful. In the first place, those who have the deepest most chronic homelessness, they don't even make it into these programs because we set these rules, you have to do this before you qualify for the program. So they don't even make it that far. And without getting into the housing, we have no hope of effective treatment programs. Housing is core. We also, once they got into the program, they were all time limited. So homelessness was still just around the corner. I mean, this is a real, Housing First is a real change for social services. Before the social service developed the programs, and they told people what they needed. Mm-hmm. With Housing First, it's completely reversed. The individuals that are being served get to say what it is they need. It's about recognizing that each person's an individual, that they all have individual needs, and we have to respect their prioritization. It's wrapping the services around the person, not throwing them out of agencies. It's a huge switch.
It sounds to me like a more humanistic approach.
That's right. I think to me, Housing First is about recognizing that people can't address their health needs if they're worried about homelessness. Like, how can you? How can you talk about dealing with your mental illness, dealing with your chronic illness, whether it's diabetes or heart disease, trying to manage an addiction issue you might have if you're constantly worried about where you're going to live?
Do you think there's a need in Kenora to get the word out about the Housing First model, or have you seen progress in that area?
I hear the words a lot, but when I talk to people, they still think that, oh, you should qualify for the housing. It's, you know, you shouldn't just be given things. There's a negativity that housing is a benefit that you earn. We can't, nothing will proceed. We can't earn what each citizen of Kenora is entitled to be housed and fed adequately.
Good information to think about. I think it really broadens the lens of our worldview about how we look at health and how we look at the impacts on health, and housing being one really concrete example here in our community. I'd like to focus back a little bit more now about the Week of Action Against Poverty, and how do you see that tying into health and the social determinants of health, about what we talked about earlier on the show?
Oh, as health is everything, and as you watch the activities unfold, you see how they all connect in. We have supports for education, for young families. The Minto Family Resource Center is often a beneficiary. There are school breakfast programs that benefit during Week of Action Against House. All of it ties in, and it really broadens out our view, as you said, the world view. And there has never been a week where I didn't learn about some aspect of poverty and health that I never thought of. There's always something we're learning.
Yeah, for me, it's really important about just raising the profile of the issue and increasing awareness and understanding.
And doing something about it.
That's right. That's right, and feeling that you can take action.
Mm-hmm.
I think also there's the opportunity to hear personal stories. And that's really impactful because it is really about what a person's experiencing and understanding that can drive that type of change.
And there's a lot of value in lived experience too. Sometimes people don't think they have a lot of knowledge, but people who have lived the life, and that's part of the books and the stories that we try to get the word out to help educate other people about what it's like living, you know, and hearing in somebody else's shoes about what they deal with on a daily basis. Is there anything else, Kit or Nan, that you would like to add before we wrap up the show?
I think we really need to make sure that this conversation about poverty and the determinants of health needs to be carried on every day, not just during the week, but all through the year. It needs to be guiding us in developing our community. Because until we start dealing with all of these issues, Kenora is not going to move forward. We have to unstick ourselves. We can't wait for someone to come in from the outside. We have to deal with local issues locally, and there are ways to do it. Kit mentioned about feeling that you can do something, and we need to have that sense of competency and capacity to make change.
That's right. Yeah. I think the issues with social factors can get quite complicated, and they can feel very, very large. But there are things that can be done. There are things that can be done at a higher government level, but there are definitely things that we can do at an individual level. From my perspective, to drive forward this change requires a grassroots approach or a community approach. It needs to come from people recognizing the importance of this issue, learning more about it, and then taking an individual action and then a collective action together to improve on some of these social factors.
Kit, thank you, and Nan, thank you so much for coming on Health Beat today. That wraps up another episode of Health Beat. Today, my guests were Dr. Kit Young-Hoon, Medical Officer of Health for the Northwestern Health Unit, and Nan Normand, Executive Member of Making Kenora Home. Thank you, and see you next time on Health Beat.